and our entire nervous system has the ability to adapt and change. Let me just quickly begin by giving a brief history of neuroplasticity, and basically it was an Italian anatomist in 1793, Michele Vincenzo Malacane, who discovered that the brain, and particularly a part of the brain called the cerebellum, is actually substantially larger in an animal that is being trained compared to an animal that hasn't been trained, okay? Which makes some sense to us now. And then in 1890, another fellow, William James, he said that the idea that the brain and its functions are not fixed throughout adulthood was proposed at that time. But the weird thing is, for most of last century, it was taught in neuroscience, and even when I went through, which was sort of 20 years ago with neuroscience when I first started, was that the adult brain was thought of completely unchangeable, that it was hardwired, and not much could happen to it after a certain period. But then there was a discovery by these two fellows in the 60s and 70s, David Hubel and Torsten Wiesel, and they found that when they worked with the visual system of little kittens, and what they did was they actually would, it sounds pretty cruel, but I have to tell you what happens because it gives you an idea of what happens, but they would sew one of the eyes shut on a kitten, okay? And then they would, and this is from the 3rd to 8th week of life, and they'd sew that eye shut, and then they'd measure the back of the brain, because that's the occipital lobe, which is where the visual information goes to, and they would look at that area of the brain to see what had happened. And the thought process was that, well, if you're sewing one eye shut, one part of the brain will actually switch off. But what really happens is that that part of the brain still works, and the other eye, which is open, actually receives information to that area. So it's like there's this cortical real estate that we have that we don't want to waste. So they said that there was this period of plasticity only in the critical period, which is in that early stage of a kitten's life, which you can extrapolate that to adults. And they got the Nobel Prize for that in 1981. In our adult brain, a newborn has a brain that's 400 grams, and these are cross-sections of the brain. And a toddler, aged 2 years, has a brain that's about 1 kilogram. You'll see that the biggest growth in a baby's brain is not so much in the number of neurons, but actually in the connections between those neurons as the child's learning. Okay? Now, there was another fellow that came along around the same time, and he started looking at, look, maybe this neuroplasticity could occur beyond the critical period. And so how he worked that out was that he did some experiments where he actually would cut in some monkeys, he would cut a particular nerve that supplied their arm and hand, and that would make their hand work. So he'd cut that, leave it cut and open for a period of time, and then he'd sew it back together. And what should happen, theoretically, was thought at the time was that the part of the brain that related to the hand movement, this left-hand side of the brain, would actually be all jumbled up because it's being cut for a period of time. But after you sew it back together again, and then leave it some time to sort of heal, and he found that it would actually rewire. And that rewiring beyond the critical period was his first idea that, wow, this stuff doesn't just happen in those early stages, but it continues on. So that neuroplasticity could occur beyond that critical period. So, and he said that if the brain map could normalise its structure in response to an abnormal input, which is cutting a nerve, a major nerve to the arm, the prevailing view that we are born with a hardwired system had to be wrong, and the brain had to be plastic. Now, he's been one of the pioneers of neuroplasticity for the last 3 decades. And he's made some very ambitious claims for the field of neuroplasticity. And he suggested that brain exercises might be as useful as drugs to treat diseases as severe as schizophrenia. And that plasticity exists from the cradle to the grave. And that radical improvements in cognitive functioning, how we learn, perceive, how we remember, and even possibly these changes are actually seen in the elderly. Now, we're really seeing this now, and some of you may have been aware of some of the work with stroke victims, where the traditional treatment for a stroke victim is 6 weeks of care post-stroke, and then basically, if possible, to be sent home. And those patients who've had a stroke are often have got spasticity in their arm and spasticity in their leg, and they're unable to use that arm, and there's a lot of movement like this if they're lucky enough to have elbow movement. If these people are actually trained, and actually it's very cruel, but what you do, you put a glove on their good hand, because the thing is, people are very self-conscious of something, an injury like this, and they'll hold their arm in this position, and they don't want people to see it, so they'll use their other hand for absolutely everything, which is really working, the other side of the brain. We want them to work the side of the brain that's damaged. So you actually basically put a big glove on this hand so they can't use it, and it makes them use the other hand, okay? And they'll try and they'll try and they try. And if you do that over a period of time, and this is hours and hours a day, days at a time, weeks at a time, months at a time, these people can end up feeding themselves, they can end up walking again, they can... there's a wonderful video of a fellow who was an eye surgeon, had a severe stroke, and then basically was completely unable to use his arm. He now does operations back on people's eyes after he's done all this training. Okay? And he had a very severe stroke and was told that he'd never be able to walk again, never be able to use that arm again. Now he can he does that, which is pretty amazing. So, essentially what we're learning is that our brains are plastic. Now the Italians knew this over 200 years ago, but we're sort of saying now, wow, it's amazing the brains are plastic and that they can change, and that change can occur throughout our adult life. So in our adult brain weighs 1.6 kilograms, so more connections again. And there's also some myelination, which is actually the material around a nerve which makes the nerve transmit faster. We have 100 billion neurons in our brain and up to 80,000 connections between each neuron. It's a lot of connections. These are cells within the memory area of the brain called the hippocampus, okay, which is obviously where there are a lot of connections. Okay, and when you meet someone, how do you know that, and you meet them again a year later, you file that person's face away and their persona neatly in your hippocampus, and then when you see them again, you know who that is immediately because of those patterns and connections that have occurred between those cells within your hippocampus. It's pretty amazing, really, when you think of it like that. So this, I call it new understanding of neuroplasticity, that's over 200 years old, is giving practitioners a better insight as to why people might develop certain injuries, problems or conditions. So from my experience, most people end up seeing a chiropractor, which is what I practice as in the field, because of a failure within their brain. They might come in with back pain or neck pain or knee pain or something like that, but essentially most of the time, unless there's been a significant injury, it's a failure within this structure up here that means this stuff doesn't work properly. So when someone comes in and they've rolled their ankle, okay, it's a different story if they've come in and they fell down a ditch and rolled their ankle and broke their ankle. That's bad luck. But if someone's got this dodgy ankle that they keep falling over on all the time, they're walking along and they just keep falling, that's because the brain is not controlling the muscle tone around that, and you're not getting good feedback from the ligaments, muscles and tendons and the little spindle cells that are in there to tell you that your ankle's going too far and you need to correct it before you go all the way. And a lot of people get these little micro sprains. They're doing that, so they get to the end of the day and their ankles are sore and they can swell up sometimes. You see it in the over 35 soccer, where after the match they can't walk for the next 3 days and their ankles are a bit swollen up. They haven't sprained it, but it takes them about Wednesday before they feel better again. Back pain. This is classic recurring back pain due to poor core stability. In our core stabilising muscles, people have heard of the term core stability. Core stability is controlled from higher up, descending down, and we'll talk about that a little bit later. Disc protrusions. This is a great example of a 16-year-old girl. This is a cross-section through the lumbar spine. She's got a nice big healthy disc here, this white material. That's a nice one up there. This one, that white material has squeezed out, just as a Darrell Lee chocolate soft centre would squeeze out after you broke the outside casing of the chocolate, and it's pushing pressure on the nerves. The nerves are coming down here. So she came in with extreme leg pain and couldn't walk. She'd been playing netball. But what you'll see with her is that this white stuff here is fat. And the deep muscles around the spine are the muscles that protect you for when you're doing little movements and you don't want to hurt yourself. But these muscles here are full of fat on her, and the muscles, the levels above, are actually okay. So I know for a 16-year-old girl, that's because there's a neurological disconnect to those muscles, and those muscles aren't being fired when they need to be fired. And so she's developed a large disc protrusion, which is just a symptom of this failure of these muscles to actually work. And so there's a big disc protrusion. And if you take a cross-section here, you'll see why she's getting all the pain. This is the disc, okay, on top of the vertebral body. This is the bundle of nerves, okay, that are travelling straight down. This is one of the nerves that's about to go off that way and down to her, this would be her right leg on this side. And this here is the disc protrusion, very large, and it's completely obliterating the nerve going down to that leg. Okay. Other people have just got good old-fashioned wear and tear and degenerative changes, and this is, again, often to that poor neural feedback and not knowing where you are in space. And people's spines and other joints can just deteriorate over time without people's knowledge, and they get these sort of changes. Someone might have a nice normal neck, nice normal disc spaces between each of the vertebrae of their neck. And then this lady, she actually came in with knee pain. Okay, but I saw that she had a whole bunch of neck problems and she was moving in like this, and so I had some films done of her neck, and she's got amazing degenerative changes in her neck. She actually wasn't that aware of them. She knew that she'd had a sore neck throughout her whole life, on and off, but it never bothered her too much. She's a little bit lucky though, I must say, because the space between here and here, she's actually just got a really big space, okay? And that space is important because that's where the spinal cord travels. So for her spinal cord's going down here, and it's got loads of space around it, and you get some of these big footballers that you see, and they've got this tiny little space for this big bundle of nerves and spinal cord to go down, and they get one little injury, or multiple little injuries, they think are little. They get a disc problem, and next thing you know, they're either out or they need major surgery because they've got limited space for that spinal cord. So she's gotten through life pretty much unscathed, although she's got a lot of arthritic change, because she's just got a big space for the spinal cord to travel. It's luck of the draw sometimes. Blood pressure changes. Blood pressure is about peripheral resistance, and what controls peripheral resistance is actually our brain telling the blood vessels to constrict or dilate. Okay? And why do people's blood pressure get higher as they get older? Because quite often the cognitive functioning is dropping somewhat. There's also the fact that they may develop cholesterol plaques, but it's more what drives blood pressure is actually that constriction and peripheral resistance. So the brain has got a large part to play in controlling someone's blood pressure. You've got the blood pressure of a teenager who lives on junk food, TV and the computer. And this is going to be a problem in the future because a lot of young kids now are much less active than what people in older generations have been before. So they're going to be starting off from a lower base point. Bowel irregularity, the balance of blood movement between the bowel and also our big muscle groups. You can't digest food while running away from a lion. So basically the brain has to decide through your sympathetic or parasympathetic nervous system where to deliver blood to. Okay? So that bowel irregularity comes from an imbalance sometimes between the brain's control of where that blood's being sent. And people who eat lunch on the go is like running away from a lion because they're busy, they're doing stuff, they're having lunch, and then they wonder why they've got all these bowel problems. It's because there's this dysregulation between the poor old brain's not sure whether it's coming or going, there's no rest and digest, and so they're having some issues with that. Brain's connections to the bladder and pelvic floor. This indicates definitely loss of the control of the nervous system at that level. We need to maintain some control of these muscle groups, and you need to practice these muscle groups. You can practice them while you're here. No one needs to know you're doing them, but these muscle groups are very important. You want to maintain your brain's connection to these muscles because if you don't use it, you will lose it. And they hold some pretty important structures up, stop them falling down. Dizziness and vertigo is something that I see a lot, and basically this results when there's a miscommunication between your eyes, your ears, and your spinal joints to tell you where you are in space relative to movement. And falls. These definitely increase with decreased cognitive function. And so consequently they increase as people get older. And the statistics on falls are horrific. 1 in 3 people over the age of 65 fall every year. Of those, 1 in 10 end up in hospital. And if you end up in hospital, 8 out of 10 don't come out. And that's often because there's a complication from a hip fracture, they develop a pneumonia, and that they either will pass away or they have to go to a nursing facility to have long-term care. So, enough of the bad news. What about the good news? The good news is something can be done about it. And neuroplasticity and our brain's ability to adapt and change is the key to these long-term changes in our brains. So let me explain how this might be done. So neurons are the cells of the nervous system, and this is a zoomed up view of a neuron in the nervous system, and it's activation of neurons that leads to chemical changes within the neuron. And if you activate a neuron long enough and in the right fashion, physical changes occur within that neuron. That neuron becomes stronger. Now, that neuron gets a better protein network in it, and it'll have better strength in the actual neuron itself. When a neuron is dying, the walls of the neuron just start collapsing because the protein inside is actually dissipating, and that cell will eventually undergo death. Some very quickly, some progressively and slow. So for improvements to our nervous system, we need to do one of two things. We either have to create new neurons, or we have to extend the life of existing neurons. But how might we then begin to take advantage of this neuroplasticity, and what can we do to make sure we extend the life of our neurons and also help to create new neurons? Well, it's quite simple. I break it down to 3 really easy steps. And the first one is that we actually have to breathe. And I'm glad Peter started off by saying I'd like everyone to take 3 nice deep breaths. And what was nice to see is that actually it took a period of time for people to take those nice deep breaths, because most people in their day-to-day life actually breathe too quickly. And they don't take enough time to expire the air out or pause after the expiration before they take the next inspiration. Our brain might be only 2% of our body weight, but it's up to 20% of our oxygen supply that it needs. So our brain's actually very sensitive to these needs of oxygen.
Say that again.
Our brain is only 2% of our body weight,
Yes.
but it takes up to 20% of the oxygen supply. So basically the brain is very blood dependent. 4 big vessels go up into the brain, supplying lots of blood to it. And that's because the cells are so active. There's 100 billion of them. They need a lot of energy, and they need a lot of oxygen to maintain that. I put an oxygen saturation monitor, pulse oximeter, on my patients and just measure their pulse, their blood oxygenation. I'm amazed at the number of people that are travelling around day to day on 94 to 95% oxygenation. We should all be at 99%, at worst 98%. I find it really useful for smokers because you put that on their finger and they're sort of 93, 94%. And they're like, ooh. You know, and smokers respond to something that's sort of objective, because everything else is like, you might get lung cancer, you might get this, you might get that, but it's never going to be them. But when they see it's actually affecting them right here, right now, they get a bit more sort of worried about that. There's another area of the brain called the basal ganglia. It's deep within the brain. It controls a lot of our movements. And so some people who've got problems with, say, Parkinson's disease, have got tremors and things, that's a problem with their basal ganglia. But that's extremely oxygen dependent. And people who often get little twitches, okay, and you see their under their eye twitching or other twitches in their body, that's often a sign of poor basal ganglionic output because of low oxygenation levels. And if you have low oxygenation levels for a long period of time, expect neurological consequences as time goes on. So the diaphragm, it's shaped like a parachute, sits underneath our ribs and directly under our lungs. It also attaches onto the spine, and sometimes the diaphragm goes into spasm and actually causes a lot of people pain and discomfort around that area as well. So if everyone can put their hands on the outside of their ribs for me, just there, and I'd like you to take a nice deep breath in and out. Pause for a moment, and then take a breath in and out. Okay. So a lot of you are quite okay, but what you'll notice is that when we breathe in, what should happen is the diaphragm descends as it's like a bellow, and it sucks air in. So as it descends, it pulls down, and you should feel your outer ribs expanding out as you breathe in. So it should be, and we call it bucket handle breathing. So it's like a bucket handle going, as opposed to what a lot of people do, which is mouth breathe, and breathe very high in the chest. And they'll feel their ribs pulling up as they breathe in, and these are the people that carry the weight of the world on their shoulders because they've got all this neck muscle tension here because they're pulling using their accessory respiratory muscles and pulling up all the time and upsetting those muscles here. So you want to, as you breathe in, your diaphragm pulls down, and then as you breathe out, your diaphragm will push up. Okay? So just make sure you're using your diaphragm correctly. That's why yoga works so well, it's why meditation works so well. Psychologists use it for anger management. You know, there's many aspects to just simply breathing. And you're giving your brain more oxygen. More oxygen means more neurons, and keeping those neurons that you do have nice and healthy. Secondly, neurons rely on a good energy source. So take a look what goes into your trolley, and even more fun, look at what's in other people's trolley when you're at the supermarket. It's one of my favourite pastimes. And you just have to look into people's trolleys and see what they're actually getting. If it's full of processed packaged foods that can live in your pantry for months on end, it's highly likely they're not that good for your brain. They're also not that good for, you know, people's figures and shapes and things as well, but eat well for your brain's sake and your neurons' sake. Eat foods that look more like the brain. I mean, how can that not be good for your brain? It's a little brain. Walnuts are great for the brain. As are lots of, you know, fruit, vegetables, nuts and seeds. Other nuts and seeds that are good for your brain are almonds, macadamias and pumpkin seeds. So you get a lot of zinc and things from those as well. So eating well for your neurons' sake is very important. And thirdly, and very importantly, is we need to move. The neurons need to be activated. They need to be told that they're alive. And there's lots of evidence now showing that basically exercise can create a stronger, faster brain. But I better back that up, so I'm going to show you a couple of little quick studies that have been done. And one of the things that atrophy is when basically tissue loses size. And so the brain can atrophy, just like a bicep muscle can atrophy. And so nothing speeds brain atrophy more than being immobile and in the same environment. So we need to move, and we need to have different surrounds all the time. Okay? The monotony that often happens to someone's brain basically undermines our dopamine and attentional systems, and the dopamine is so crucial to basically maintaining brain plasticity. It's why you don't want to end up in a nursing home sitting on a chair with a blanket over your knees, just like this, not having any physical or mental stimulation. It's the quickest way for the brain to just go straight down. And I don't know if you see many people where they've been functioning quite well, they may have a little injury, they become immobile, and then they rapidly decrease. This is a cross-section, coronal section through the brain, and it compares basically healthy tissue on this size and the size of healthy tissue and the size of tissue here. And basically what you need to do is consider that you're more likely to suffer from degenerative brain diseases if you're less active. And this side of the brain is good. This person has what condition do you think? Dementia. Yeah. So dementia, you get loss of neurons. The network from the neurons extend down and get all tangled up as well. And so this person's brain, the spaces between become larger, convolutions become larger, and the tissue becomes less active, as indicated by the various colour differences here, and decreased in size. So, in laboratory research, it has been found that mice that exercise produce 2 to 3 times as many new neurons as mice that don't exercise. Okay, that's pretty cool. And we can extrapolate this maybe to the human, and this is definitely true, that exercise can improve the performance of the brain by boosting our memory and improving our cognitive processing speed. But you can't just take my word for it. Great neuroscientists at Columbia University in New York City showed that after 12 weeks of exercise, 1 hour, 4 times a week, so it's 1 hour, 4 times a week, participants became more fit, surprise, surprise, but importantly, blood flow doubled to the area of the brain responsible for memory. And that little area inside there is called the hippocampus. And as we mentioned earlier, that's the thing that files all our memories away and puts them in different places. But if you want to improve your blood supply to your hippocampus and you want to improve your memory, just do some exercise a few times a week. Now, importantly, I like to let people know that exercise does not have to be taken seriously, but it needs to be taken regularly. It's because a lot of people get a bit put off by the whole exercise thing. It's like, oh, this is too much hard work. I have to go join gyms. I have to do this and that. But just regular movement. So much so, these two ladies in the background are talking about one of their husbands, and the doctor said that he needed more activity. So I hired his TV remote 3 times a week. So another study found that 3 times a week for 40 minutes, so this is even less. The other one was 4 times a week for an hour. I mean, you know, but 3 times a week for 40 minutes decreased the risk of dementia by 40% and bowel cancer by 30%. Do you think if there was a drug on the market that said you would reduce your risk of dementia by 40%, who would be taking it? I mean, everyone would be taking it. 3 times a week, 40 minutes, decreases your risk of dementia by 40%. So it's important to realise that it's not a brutal workout that's necessary, but walking at a good pace stimulates the growth of new neurons. And the other thing that people should realise is that we need to stay flexible, okay? And I see a lot of kids in practice, and kids these days, the parents are disgusted when I say, just bend forward for me as if you're touching your toes, and that's as far as they get, and they're 8, okay? If you're like that at 8, how are they going to be when they're sort of 18 and 21, and how are they going to be when they're, 78? So stay flexible. And we'll talk about that. The problem is if the brain doesn't have sort of physical input, it's what also makes them tighter as well. So they're neurologically tight, not just physically tight in their hamstrings. And we'll mention that in a moment. So from my perspective, in practice, how does one identify that a person might have a functional brain imbalance? Well, firstly, we have to look into the brain, and we have to actually look deep within the brain. So this is a real human brain. This is where prosector comes in. This is where I'm allowed to take these things out of people. They're generally dead, it's okay. This is the frontal lobe. Okay, this is what some people say makes us very human. Here's the temporal lobes. This is the brain stem, and this is the cerebellum. Cerebellum's our little brain for posture and balance. These are our little olfactory bulbs. They help us smell, so that information goes straight up through our nostrils and straight to the brain. If we then take a bit of a closer look at the brain stem, you'll see here, these are the optic nerves that go out to our eyes. Okay, the optic chiasm. There's a whole bunch of nerves that come off the brain stem, and these are called your cranial nerves, and they basically help your eyes to move. They actually give you sensation on your face. They allow you to taste. They allow you to turn your head and do this. They allow you to hear, see, move your tongue, swallow. So these are all different nerves that come off the brain in through here. Again, that's the cerebellum, nice and close to that as well. So our brain, I hope you don't mind this for Sunday morning, but our brain sits inside our skull. But it's not just like this. It sits inside a lovely little bag. And that bag is connected to your skull base, and it's called the meningeal layer system. It's got 3 layers. The outside layer is called the dura mater, which in Latin means tough mother. And it is tough. And this is it here, it's this stuff here, and if you get it and you try and pull it, it's really, really strong, okay? And so our brain's wrapped around that, and it protects our brain. It also forms dural sinuses, so it's adhered to the skull surface, but it forms these little gaps, and those gaps is how all that blood, which is a lot of blood going to the brain, that's got to get back down to the heart again. So it drains back down through these holes, and then back down your jugular veins and into your heart. So here, the top part of the brain's been taken out. The cerebellum's actually still in there, okay, in the bottom part of the brain, posterior fossa, and the cerebellum's in there. The brainstem's still in there. You can see the nerves that are coming from the brainstem. These go inside to the eye, and these ones control your eye movements inwards. And then you've got other nerves that come in through here. Lovely little dainty nerve that comes in and goes to the eye, and that controls your eyes to move downward. So when you walk down steps, you don't see double, and you don't fall over. And various nerves, these are the nerves going out to your ear. So the dura sits in there, and it's nice. Now you probably wonder why I'm spending so much time telling you about the dura, but you'll see in a moment why it's so important. This is the back of the brainstem. This area here is called the corpora quadrigemina, for more big words for today, but this is the superior and inferior colliculus. So when you see something in your peripheral vision that's coming in and you want to quickly look at it, that's these two little bumps here that cause you to look at it. This one here is if you hear a sound in the background and something sort of making noise and you want to go look at it, you'll actually do that, and that's that part of the brain. These are really important for survival. This is if you're hunting and you hear a noise and you're like, oh, what's that? I'm going to run after it. Or you see something in your peripheral vision. Or if you see a snake slithering on the ground, you're going to go, look at it and quickly jump backwards. And that's hardwired into our brain, the fact that all animals distinctly know that slithering is not good for them. It's a true story. So here we have huge big bundles of nerve fibres. So this is not the nerves, but the nerve bundles, and these go into the back of the brain, right down the bottom, called the cerebellum. And the cerebellum has got a huge number of neurons. There are more neurons just in the cerebellum than there are in the rest of the brain. And these, again, are very important for our posture and balance. Peter mentioned before, when everyone stood together with their eyes closed, a few people got wobbly. If you were wobbly straight away when Peter did that, that's because your sensory system's not very good at adapting where you are. Some people noticed that they were okay to start with, but they got a bit wobbly later. That was just the love. But the first bit of the first wobble was actually proprioceptive, or your ability to know where you are in space with your eyes closed. And that was controlled by your cerebellum and all these pathways that run between them. Then this is a cross-section down through the middle, through the cerebellum. It's a beautiful structure. It's the arbor vitae, or the tree of life, in through here. This is the midbrain, this is the pons, and this is the medulla. And all the way from here through the midbrain, where it says tegmentum, all the way down to here, is a whole bunch of cells called the reticular formation. And it's actually called the pontomedullary reticular formation, or PMRF. And that's important for postural tone and muscle tone. And that's really important signs to pick up in people, because you can pick up some of these, what we're going to talk about now, very subtle clinical signs which indicate that that area of their brain's not functioning very well. So when you examine someone's brain, you can examine them for quite obvious neurological deficits, when they've got this sort of stuff going on, and they're walking like that. Or you can see more subtle things where they might just have a slightly rolled in shoulder on one side, which is a more soft sign but of the same structures. So what subtle signs might we look for when looking at an individual's brain? Well, we can look for signs of autonomic dysregulation. Okay, so this is David Bowie, but he's got here on this image some pupil asymmetry. And pupil asymmetry, when the pupils are large, is that their sympathetic or parasympathetic nervous system that's going nuts? Sympathetic. So when you're actually under threat or stress, pupils will dilate. That's to let more light in, so you're much more alert to see what's going on in the environment. But if you see asymmetry in people, that indicates that one side of their nervous system is not functioning the same as their other side of their nervous system. So people, I had a patient just the other day, I noticed this on her, and I said, have you ever noticed one pupil's larger than the other? And she said, yeah, my husband just says I've got crazy eyes. And which was good for me, because I knew how long she'd had it for then. It wasn't just a finding today, because it can actually also mean signs of pressure on the brain and signs of tumours and other things. But in her case, it was just actually this asymmetry in her system. Some people have just got very large pupils on both sides, which the human species finds very attractive, but those people often suffer migraine headaches. So that's an interesting finding as well. What else can we look for? I hope the light's all right here, but this person here's just got, can you see that her face is not completely symmetrical on one side to the other? Yeah. So this is common, and it allows you to easily pick up asymmetries in muscle tone. And that's, again, arising from that part of the brain which sets up the muscle tone. And you can see that one eye's a little bit more open than the other, one eyebrow's working better than the other. There's often soft changes around these what are called nasolabial folds, and you can see that one's bigger and deeper than the other. Some people have got much more obvious facial tone changes, okay? And this is a young girl. She had a whole lot of learning difficulties and things as well, but there was a lot going on in her face which can alert you as to what's happening in her brain. You get someone to open up and say, ah, and the uvula should actually sit dead set in the middle, okay? But this is a very soft sign in her case, slightly moving to one side over the other. This means this side of the palate's stronger and it's pulling that side across, and this side is weaker. And that tells me straight away that one part of her hemisphere is not working over the other. We also, in babies, it's very important to look at where the brain sits. It sits inside a skull, and a baby's brain's really soft, skull's very soft, and so we want to look and see that the baby has a nice, evenly round-shaped skull. And if you draw a line from the back of each of their ears across, and then a perpendicular line, it should go right through, smack bang, in the middle of the nose. Some babies basically develop a flattening of the skull, and this has been really apparent since the Back to Sleep campaign for SIDS in 1992. So before that, every midwife told people to sleep babies on their front, because they just sleep better on their front. But now, sleep them on the back because they're less likely to have sudden infant death syndrome. But it's causing a lot of problems because a lot of these kids have got dural tension. So they've been in the uterus, they've been squashed up in a certain position, and that covering over their brain, that not only goes around their brain, but it goes all the way down their spinal cord and back around again, actually got twisted and caught in a particular way. So when they were born, they've come out and they're only comfortable in a certain position. So they'll want to sleep in that position. And so when you lay them on their back, whereas before you were told to put them on their front, turn their head one way this time, turn their head one way the next time, and that would sort of even them up. But these kids are just going to their comfortable position, and in 4 to 6 weeks are developing these big flat spots on their head that look just like this. And these flat spots, they're never as good in two-dimensional photographs as they are in real life. In real life, they're much more dramatic. So these flat spots, once were thought of, don't worry, it's an aesthetic thing. Their hair will grow, it will cover it up, and you won't notice it. But we do notice it, and the new science is that basically it is causing cognitive delays, motor developmental delays, and learning disabilities. Okay, subtle, but they're there. This is an MRI just showing the relationship between the skull and the brain. The brain sits very snugly inside that skull, so expect the brain to have rotational stresses if the skull's got some flattening on one side over the other. So really shouldn't be surprised that it's learning difficulties and other things coming from that, but I must say the West is quite far behind the East. One of my patients brought an article in a few years ago, this was in 2007. She said, you see lots of babies with funny heads, I've seen them in here. I've read this interesting article in the paper today, and she translated it for me. And basically, there's this city in Yunnan province in China, and they basically will charge $15,000 Australian for the children's schooling per year, but they guarantee that that child will recognise characters by the age of 2, they'll be reading by 3, they'll have high school by 7, and they'll be in university by 15. Now, I'm not sure that's something you want to aspire to, but the only condition for this school, apart from having $15,000 every year, is that the child has an evenly round skull. So they basically look at the kid and go, yep, you're in, yep, you're in, too crooked, too hard, you're out. And so they're selecting their children based on a nice evenly round skull because they realise that it's easier to work with a brain that's nice like this than a brain that's being squished a bit on one side over the other. So their brains are still plastic, but maybe they're not as plastic and flexible as these kids that have got a nice round skull. So what else can we look for in people to sort of highlight evidence that there's something else going on with their systems? Well, they might have a subtle head tilt. So in this case here, he actually looks really good. He's got nice even shoulders, everything's perfect, but his head's tilted to the side. Now with your head being tilted to the side, what happens is that your eyes have to rotate. And so the plasticity model extends to the nerves that go to the eyes, and also the muscles, which basically are going to be stronger on these external rotators on this side and the internal rotators on that side, and their head's going to be like this, but their eyes will be like that. So their muscles are going to be stronger here, and that creates plastic changes within those. And so they, over time, have to stand with their head tilted to the side because that's the way their eyes like to work, and they function better. I don't know if you've ever heard of behavioural optometrists speak. Awesome. Behavioural optometry is fantastic because they're not just looking at the lens and prescribing a set of glasses, they're looking at this and saying, you need to change how those eyes work. And it has a massive influence on the brain. And the younger you get those kids that have got those problems, from an optometry point of view, the better. If you take them to a regular optometrist, they'll often just be like, oh yeah, set of glasses, you'll be right. But these kids need certain exercises and they need to be doing those to help them with their plastic changes of their brain. And you need to do the exercises regularly in the initial phase, and then you can do less as time goes on. It can be a sign when someone tilts their head to the side that their cerebellum's not working as well on that side. So to fire it up, what they do, they tilt their head to the side to wind it up. Okay? And that's how we stimulate the cerebellum. We tilt our head or we spin quickly. Okay? Which is also why it's good to get kids to spin really fast in both directions. And adults who've got poor functioning cerebellum, I've got to tell you, don't like being spun. I can sit them on a chair and slowly turn them around the room, and when they open their eyes after one revolution really slow, they're like, whoa, what's going on there? And these people are the ones who suffer motion sickness as well. So they're the ones who definitely can't read a map in the car while they're a passenger. They can't read a book. In its more severe states, they can't get on airplanes. They feel sick for 2 weeks after being on an airplane because they've got motion problems after just being on an airplane, and forget about boats. So this is a sign of poor cerebellar function. Okay? And there's exercises you can do to actually help that, so that people won't suffer those things. This is a good example of someone who comes in, lies on the table, and they're crooked in the world, and yet they don't know it, and so they think they're lying dead straight. And this guy's not even walking straight, right? So look at his shoe wear. He's got uneven wear on different parts of his shoe because he's actually walking funny as well as having his, being off in space. So this is poor adaptation of the nervous system to deal with where they are in space. This is a good example of a fellow who he has severe motion sickness. And so I'm going to get him to march on the spot, okay, just like this. And he's fine if he's marching on the spot like this. But it gets more exciting if I get him to close his eyes. So watch as he marches on the spot, and we all should be able to do that and basically end up in the same spot. Some people will move forward because we're so used to moving forward as we walk, but watch what happens to him. Close your eyes, marching on the spot for me. Now, the true test is 100 steps. Quite often I have to stop people because they're going to run into something. Most of the time I do 50 steps in practice. Now, he's just turned around. I wish I'd kept the camera rolling because he thought I just played a big practical joke on him. He thought I just moved the whole room. And he just turned to me. And then his next question was, which way did I go? He wasn't sure if he went left or right. Okay? So this is the cerebellum just really not giving good input. So he's not going to, he certainly can't read in the car. So we can see that. So basically this is failure of his sensory motor integration pathways, and this is the Fukuda marching test. Okay? Now, do you think if you're like that in real life and you're spinning in circles without your eyes open, this is not good for your joints? So what happens, you take CT scans of these people, and then this is a CT scan, and you take a section straight down the middle, and this shows us all the lovely little joints between each of those vertebrae. Now, this is those head tilts that I'm talking about. You can see there's a head tilt here. This is the world being off skew. But over time, this is a 45-year-old male, basically it wears those joints out. Okay, they switch off because they're not getting good information, and then those joints actually become arthritic, and that becomes a whole new extra problem on top of what's happening there already. But essentially, this in this patient is a result of him having a problem with his cerebellum. So you can see the arthritic change that's in through those joints. The other classic for me is that people who have a hip replacement, and if you often ask someone, why did you have a hip replacement? Their answer is, oh, well, the hip was old. It's like, how's the other hip? Oh, it's fine. And how old's that hip? And then they're like, yeah, what's going on there? How come this one wore out and this one didn't? Basically, joints wear out if they haven't got protection, and the protection comes from your muscular system. So if I stand on one leg, if my glute medius is functioning well, I won't fall over like this. If my glute medius is not functioning well, the people can't stand on one leg because that hip's failing them all the time, the muscle. And so when you see people walking along and they're walking like a duck, that's because they're throwing their body weight over to one side because they haven't got the muscle. They're going to fall like this, so they've got to compensate, throw their body that way, and they will develop hip arthritis because there's no muscle to support it, and the joint starts wearing out quickly. So in this case, this person's got next to no space between the top of that hip and the acetabulum in the pelvis, and then when you compare it to the other side, there's loads of space. So this obviously ended up resulting in a hip replacement, which is great surgery, great outcomes, and there's a lot of people that probably didn't need to have them if they just actually got those muscles functioning properly. And it's the brain that needs to communicate with those muscles so the muscles switch on when you want it to between every single step. So don't walk like a duck. It's not good for your hips. Now, our eye muscles and our spinal muscles actually work through the same neuronal system and complex of pathways in our structures. So this is a complicated one to tell you, but I'm going to give it a go. But basically, if someone has a breakdown in how well their eyes move following a target, it's pretty much a given that they're going to have poor spinal stability. And that is because when you move your head in space, your eyes also need to move so you can fix on a target. And if you turn your head in space, and you watch a baby, if it's standing up and then it turns its head, it'll often fall over. Because it's still developing the pathways that basically mean that they can turn and then stabilise their spine. So when you turn your head, and we'll show you a figure of it in a minute, you stimulate your inner ear. Your inner ear tells your eyes through a particular nucleus in the brainstem to go, you've got to go that way because the head's going this way. And then a message goes from the same nucleus downwards to the muscles of your spine to say, you've got to turn on, you've got to turn off, because I want this person to stay stable when they turn their head. It's also why older people fall over. They're walking along, they're fine, and something gets their attention, and they'll do that. Okay? Really common, something very simple happens, they quickly turn, or there's something on the ground that they have to quickly look down for, and they'll trip over, because those pathways which they did develop have actually started to fail them. See, plasticity can work for you or against you. So that's the other factor. So I'll start off by showing you a gentleman who has a true brain disorder. He has cerebral palsy. And I'm going to get him to follow a target. Now, when you follow a target, different parts of the brain actually do that. So if I get someone to pursue a target, so slowly move their eyes following a target, that's actually your parietal lobe. Okay? So the parietal lobe allows you to pursue a target. If you then have to quickly move your eyes back to another target, that's your frontal lobes. Okay? And there's various sides that do that. So pursuing a target one side, eyes shooting back. So in this case, I'll just get him to pursue a target, and let's see if he's got a good ability to follow his target left or right. So I've got him going up here. Just watch his eyes. He's not sure which way he can move his eyes. He tries to predict. You'll see that his eyes aren't well centrated. And he's trying to get to a target. One part of his brain quickly shoots him across when he's meant to be fine because that other parts aren't actually allowing him to do that. Do you think he can read? he's actually got the capacity to read and the actual mental ability to read, but he hasn't got the physical ability to slowly move his eyes across a line. Okay? So a lot of people think these guys are stupid. They're actually very smart. But sometimes they just don't have the capacity to do some things. And unfortunately, it also can affect their speech. And so people in the surrounds think that they're stupid because they don't sound clear in their words. He is so clever. Like, he'll make an appointment with me 3 months ahead of time, and he'll say a Thursday in 3 months. He'll know the date in an instant. He could tell you the date from 2 years ago on a Thursday that he saw me. So really, really switched on. Now you've also got subtle differences. So that's someone with severe cerebral palsy. He also has, when someone has cerebral palsy, they often have scoliosis as well, so their spine's not straight because of the descending control over the spinal muscles is involved, and as they're growing, when that's involved, they'll get some scoliosis and curvature. Now this young boy, his mum brought him in because he basically was falling behind in his reading. He's 8 years old. And let's watch him pursue a target and watch what he does. Pursuing to his left and then pursuing to the right. See, he turns his head to the right. If the eyes can't do it by themselves, why not get the neck to help out? And his pursuits to the left are actually quite good, but his pursuits to the right are no good. And it's always worse having poor pursuits to the right because we read from the left to the right. So he'd done loads of extra tuition for reading, just wasn't getting there. Again, not a silly kid, but just couldn't follow a nice even target. So he had some retained primitive reflexes and things as well. That's called an asymmetric tonic neck reflex. But he had poor mechanisms to allow him to do that as well. Yes?
How did you rectify that?
So in his case, an ATNR on him was actually a cranial-based issue, and so the cranial-based issue affects the lambdoidal suture. So for him, you actually turn his head to the right and stimulate those cranial sutures, which will actually change the dural patterns underneath that, and it works a treat. So his is good, and those kids also develop a lot of shoulder problems and adults with that problem, because what happens is that the ATNR is such that if you move a baby's hand, their head will move at the same time with it. But that's a disadvantage as time goes on, and you want to be able to move your arms independently without actually having to move your head. So people who have this, they're trying not to do this as they're throwing a ball or they're playing tennis, but their brain's going, oh, I really want to just follow that and do this. And so they're trying so hard not to do it, they develop a lot of strain in their shoulder.
Sorry, Brent, you mean you're having practice turning his head?
Sorry?
You mean you're having practice turning his head?
You can test them various ways for it, but one of the ways to do it, to bring it on, is to turn his head to the same side and actually do the test while his head's in that position. But you can test it lots of different ways. Yeah. So let's look at the pathways. This is going to hopefully, I'll do this as quick as I can. But basically, if you turn your head to the right, messages go into the brainstem, and the brainstem will basically, if we get someone's head and you quickly turn their head like that, their eyes will basically stay on your nose, okay? Because it's a reflex, and as you turn their head to that side, that will send messages to the muscles, appropriate muscles to go to the left, and it will switch off the other muscles so they relax. Because if you're doing like that quickly, you need some muscles to relax and some muscles to contract. Just like if I do that, this muscle has to relax. So there's this lovely little integration of pathways here which allow this muscle and this muscle to switch on, and this muscle and this muscle to switch off. And they go through a little nucleus called the vestibular nucleus. And the vestibular nucleus, and that reflex itself is called the vestibulo-ocular reflex. But that nucleus also has nerves that go straight down through the spinal cord to stabilise you. And these arise here, and they run down through there, and they go down to the spinal cord. That's a cross-section of the spinal cord, and the spinal cord can then stabilise your axial or midline muscles. So it's a pretty neat system. And it all works on reflexes and pathways, and just so happens that some people have got poor reflexes and pathways. And these are those cells here, so the vestibulospinal system, and also the ones in that brainstem called the reticular formation, they become, or are called the reticulospinal. So all pathways in the brain, it sounds really complicated, but it's actually not really. A name from where they come from and where they go to. So vestibulospinal means they start in the vestibular area of the brain and they go to the spinal cord. And reticulospinal means they start in the reticular part of the brain and they go to the spinal cord. And then you have spino-reticular, which means they start down here and they go up there. So our brain controls our postural tone in such a way that basically the muscles in the front or anterior, above T6, which is about this level here, are inhibited, and while muscles in the posterior below T6 are inhibited. And this allows us to stand up, because if these muscles weren't inhibited, what happens is that we'd all be standing like this with really tight hamstrings. And so to be human and a really well-functioning brain, the person's actually got quite good upright posture. As the brain diminishes in function, you'll see that people get more and more rounded in the shoulders, the head starts travelling forward, and they become more like that. So high brain control means good posture. And this happens through that pontomedullary reticular formation. So it explains why some people are very tight in some muscle groups, in particular muscle groups, while others are much more flexible. So if we look here at these people, you'll see that when the brain's really not controlling that pontomedullary reticular formation really well, you might expect people to have tightened pectoral muscles. They'll have weakened extensor control through here. They'll be tight in the hamstrings, they'll be tight in the calves, and they'll be weak in the muscles of the front of their shin here, which is often why people get shin splints and things as well. So these postural things aren't just that they're not holding their shoulders back and their head back, but this is a brain deficit, and they're not controlling that part of the brain called the PMRF from the higher centres and doing that. So, yeah. So posture is governed by these higher centres, and poor posture leads to spinal stress. And what I often see the result of the injuries that occur because of these poor postures, but it's, you really want to try and treat the cause, and often preventable injuries. So this person here, he's got very tight hamstrings, tight calves, internally rotated shoulders, but I wasn't about to argue with him. So, and I won't make the wise joke about cognitive function. So, if there is an asymmetry between one side of your brain and the other though, so some people are just tight on both sides and both sides might be down, but we have situations where there is an asymmetry between one side of the brain and the other, and they might likely to suffer symptoms on one side over the other. Lots of people come in and say, it's always my right side. Shoulder problem on that side, knee problem, my ankle's funny on that side, back and buttock on the right-hand side. Is that just coincidental? Or is it that their tone on that side is much poorer than the tone on the other side, resulting in injuries on that side all the time? And so sometimes it's coincidental, but other times it really is that they've got a weakness on one part of their brain controlling that. And it can be that one part of the brain's overworked or basically not being worked enough. So that's another problem to work out. Just remember that your high brain controls movement on the opposite side. That's called volitional movement. But if I move my right arm, this side of my brain also tells this side to stabilise. So it controls volitional movement on this side, but tonal control on this side. So, because some people have got this weakness in their extensor muscles, they're susceptible to certain injury types. And what you'll see here is that rotator cuff muscle tears, quite prevalent in society, but are often set up by this weakness in the extensor muscle groups. And so people over time will develop tears in the actual muscles that supply that. So rotator cuff muscle group tears. Also, classically, tennis elbow. Most people who get tennis elbow actually don't play tennis, okay? But they've got this weakness in their extensor muscle groups, and that weakness results in an epicondylitis. Now, an epicondylitis is when the muscles are having to pull too hard and they're not strong enough, and it pulls the covering off the bone, the periosteum, and you get this exquisite tenderness right on the elbow because the periosteum's inflamed. But it's often a result of underlying weakness. This is a good example of someone who, when you get them to put their hands straight out in front, and if you just put both your hands straight out in front now, just do that. Theoretically, both hands should look exactly the same. If you find when you put your hands straight out in front and you're pointing your fingers that one of your hands does this funny little dodgy things, or sometimes both of the hands can do it, you've got poor extensor tone in those muscle groups, and it's allowing those fingers to dip because of the poor extensor control there. So this person's really susceptible to elbow injuries on that side and shoulder injuries on that side if you want to sort of have a predictive value of what's going to happen to them in the future. This young girl, she has, which side's her problem? Her left side or her right side? Left side. So she's got really poor extensor tone on that left-hand side. She's got poor visual tracking, and she's also developed scoliosis, and a very severe scoliosis. So we know she's got poor extensor tone on one side, which relates to poor intrinsic control of muscle groups of her skeletal system, and particularly the spine, and it's allowed her in those growing years, because of that abnormal tension type, to develop scoliosis. Scoliosis is curvature of the spine. And again, this is all new stuff coming out now that the scoliosis is not just a musculoskeletal thing, but it's more a neurological thing. And there's lots of papers now suggesting check eye movements for people that are at risk of developing scoliosis. If they've got poor eye movements, they're, again, much more likely to develop scoliosis. And, you know, it seems funny to send someone to a behavioural optometrist to help them prevent scoliosis, but I think it's a great place to send them. This is a friend of mine in Melbourne. He does quantitative EEGs, or quantitative electroencephalograms. Sticks a whole bunch of electrodes on your head, measures the brain activity, and then graphs that brain activity, and you can take away all that data and see if one side of the brain is working better than another. This is a patient, a 12-year-old girl, and she's got a 30-degree curvature of her spine. And here, look at this one here. Now the colorations, basically the colours should be even from one side to the other. But one side of her brain is working much more than another side of her brain. Okay, and you can see there's a large orange spot here and an orange spot here, and it's not the same on both sides. That just so happens to be in the sensory motor areas of the brain, okay? The frontal and parietal lobes just in here, and that controls all these things. So this young girl has got brain asymmetry and is probably leading her to have developed her scoliosis. And this is real cutting edge stuff, because really up until now all textbooks say, and mostly orthopaedic textbooks say, 70% of scoliosis is idiopathic, which means we don't know why it's there, but it's just there. And this is probably the answer to most of that idiopathic scoliosis, brain asymmetry. And you're probably wondering why I'm telling you about all this, but the point is you can actually fix brain asymmetry by doing correct targeted exercises. If you look at a cross-section of a CT scan of someone's spine with scoliosis, this is the classic in a scoliosis. Not only have they got curvature this way of their spine, but their vertebrae actually rotate. So you take a cross-section and you can see that vertebra is actually sitting, you know, skew. This is normal muscle tissue, nice grey colour. This black stuff is fat. So this muscle group here is full of fat and not much muscle. So it's a little bit chicken or the egg. But my guess is the egg came first, insofar as the brain has lost regulation and control over these muscle groups. The brain's not giving that muscle stimulus. The muscle just doesn't contract. Fat gets impregnated within the muscle because it's not being contracted. And that weakness then can allow the vertebra to shift and change because of the poor tone. This is someone who's got some scoliosis, a CT scan, they've had it for their entire life, and you'll see all the arthritic change that actually develops in the spine because of the curvature that's there, and the wear and tear that's going to develop because of those abnormal stresses that are on This is a 16-year-old. He has already developed a significant curvature in his spine. When you look at him from behind, you'll see that he's got a left curve here and a right curve. If you look at his x-rays, the x-rays are often worse than the actual image of the person. Some people can actually hide their scoliosis quite well, but he has a 45-degree curve in his spine. But we see 90-degree curves, like really severe curves. So what I'm getting at there is that there's a possibility that these people may have brain asymmetry. Now, a lot of people have brain asymmetry, and you've probably worked out yourself that you're more a left brain person or a right brain person, and you can determine that by how you learn and some other things. Now, a good history basically identifies some of the signs that one part of the brain is working better than another, and if you're left brain, you know, you might be an accountant. If you're right brain, you're going to be more musical and a lot more fun, and and a whole bunch of things. So what I thought I'd do now is actually just highlight some of the things, the characteristics of a left brain individual and some of the characteristics of a right brain. You can make the decision yourself. If you're really good, you sit right in the middle and you've got a bit of everything. And let's see. So the left brain people, you're the analytical people, okay? Really sort of detailed. You like information in a real sequential, linear order in a particular way to make it nice and neat and ordered for your brain. You're good with words. You're good with understanding the verbal processing of the literal meaning of words, okay, and knowing that. Great with comprehension of those words. You will plan an order response and react very logically, and you will react based on facts and knowledge, okay? And those thought patterns that are based on fact and knowledge. You've got good fine motor control quite often. You prefer familiar environments, don't like going out to new environments all the time. And you prefer processing your information at really high speed and high detail. Okay? Then there's the right brains. These are the wonderful big picture people, global, understand what's going on from all sorts of perspectives. You like to process information, give it to you any old way, it doesn't matter what order. Whoever cares can come in this way, that way. Very good in space. So that's why right brain people are much better dancers, okay, compared to the accountants dancing versus the right brain people dancing that aren't so mechanical, you know, left after right, you know, that sort of stuff. So good comprehension of tone and body language. So an ability to read between the lines, basically. So when someone's talking to you, you're not just taking their literal meaning of the words, but you might understand that they either like you or they don't like you because they're doing all sorts of things. They won't pick that information up. They will often have quite emotional responses, be very impulsive, consequently very creative. They'll have good gross motor control and spatial orientation, which comes back to that dance. They love new environments. And they'll like to prefer, particularly say information like this, which is quite, you know, intense. You know, they need to take it on a bit slower, like just slow down a bit, and you know, and go away and read it and do all that sort of stuff, as opposed to going, yep, got that, move on, hurry up, come on. So right brain. So I guess left brain people, to summarise, are your absent-minded professors that basically are oblivious to the emotional needs of the people around them and unable to read between the lines. And I think, has anyone watched The Big Bang Theory? That Sheldon is a great left brain individual, okay? Just think left brain, think Sheldon from Big Bang Theory, all right? He's a high-functioning Asperger's. I actually don't think he has a right brain. No, that's just kidding. I like Sheldon. I'm a little bit like Sheldon. But he's such a high-functioning left brain. That's a left brain person right there, just working beautifully. And they've scripted that so well. The right brain people, as I said, are really fun people to have around. They're empathetic, they're creative, but they just don't get as much done. Okay? So it's nice to think we're all, you know, we've got a left and a right brain. There are people that are born without one side of their brain. Okay, and there are great cases that there are cases of people that haven't been identified as actually not having one part of their brain until they had a CT scan or a scan when they were, you know, a teenager. And so there are people that function like that, and you can function with one side of your brain. So if I only had half a brain, it's actually okay. If someone's got a problem with their left brain and it's not working quite as well, and that can be from being overworked or not stimulated enough. You can easily develop lack of ordered thoughts, some dyslexia, need for repeat instructions. They'll have poor handwriting. They'll put the emphasis on the wrong syllable. And they can sound like they're speaking in a foreign language, or with a foreign accent, sorry. They're unable to calculate things, so acalculia. They'll often have low IQ results, because IQ testing is really more left brain than right brain. So some people don't do that well in IQ, but they're actually much better than what their IQ results suggest, because they've got a really high functioning right brain. Poor verbal memory, verbal retrieval, poor object identification, poor facts and figures memory. They often can suffer depression and lack of motivation. Poor grooming. They can become socially withdrawn and shy if they've got left brain dysfunction. They can become more pessimistic. They can have lack of pleasure. Poor fine motor coordination. Dyspraxia, which is ability to do normal tasks like putting a shirt on and buttoning up a shirt and tying a tie and doing that. Their blood pressure will often be increased on the left-hand side, their pupil will be large on that side, and they may have increased sweating on that side as well. Right brain dysfunctions. These people, these are interesting to treat actually when someone's right brain's not working very well. They're easily distractible, they lose their train of thought, very difficult at maintaining focus. So an attention deficit disorder child has often got quite a low functioning right brain, and you want to bring their right brain up so that they can focus and pay attention. I get them to learn dancing, get their parents to take them to dancing classes and things to help them with the timing and the beat and the rhythm and those things. They have a tendency to overanalyse. Some people with obsessive compulsive disorders have got a right brain dysfunction. Poor recognition of emotional tone of voice in conversation, so they just don't pick up on that in between the lines stuff. The autism spectral disorders fit in this, and again think of Sheldon, who's he hasn't got a right brain dysfunction, he's just got a very high functioning left brain. Okay. Lack of imagination, impulsivity tending towards addiction. So this is people that sort of all of a sudden get into drugs and gambling and those sorts of things. Poor long-term relationships, sociopathic personalities, poor estimation of time, poor spatial orientation, poor comprehension of stories and movies, easily get lost, have often a lack of fear, their left brain takes over, and they're sort of excessively optimistic, which is what goes into the whole gambling side of things as well. It's all right, we're going to win the next one. Increased spreading on the right, enlarged pupil on the right, and blood pressure increases on the right. So we'll often take blood pressure on both sides to have a look at that, to see how they're going. So the reason I get so interested in neuroplasticity as a chiropractor and osteopath is that neurologically, the spine has got the greatest input to our cerebellum through these proprioceptive inputs, firing to these midline nuclei of the cerebellum. And the cerebellum basically has got nuclei that come from that basically fire down as the vestibulospinal tract to maintain better posture and help us to resist the muscles that contract the muscles that resist gravity. So this guy here, he comes in, lays on the table and thinks he's straight, and he's going to get a whole bunch of issues because of that when he's walking around and doing this to his shoes. You can do some things to his spine to increase that input to his cerebellum, so his cerebellum fires up, and you get him to walk around the room and come back and lay on the table, and he puts himself straight on the table. If I put him back to where he was, he just goes, wow, that's really crooked. And yet, initially, if you put him to a straight position, he thinks that's crooked. So you can influence those things, and then if you give them appropriate exercises to fire up those areas, you can then basically even these people up neurologically. This is a young tennis player, and you can see you can get immediate improvements in posture and scoliosis, and it's probably attributed to those descending projections from the vestibular area and the reticular area to their spinal column, and you'll see that muscle tensions that develop through here can easily and quickly disappear. Posture, classic posture, you see kids like this, you fire them up, get their cerebellum working, do a few little spins and do some other tricks and the trade, and then immediately you get big changes in their posture. That's a bit more homework.
Are those changes short term or long term?
So short term, you can get those immediate changes. If they go away and do the same thing that they've been doing and don't fire up the right parts of their brain, they'll disappear. Those changes would last, hours to days, but it would decrease. So you then have to. What's important is giving them the right homework to do to maintain those changes. So, but the good thing is with neuroplasticity, you only have to do something for 3 weeks. So, but you have to do it very consistently for 3 weeks. So if someone's got a right brain disorder, for instance, what I might do with them is that they've often got really poor timing. So I'll get them with a metronome doing this. Clapping in time with a metronome at 54 beats per minute, and then get them to basically do their left arm. Now, kids that are no good at this, basically they're going, trying to land on a beat, and they've got no idea. So you get them doing this. Every day they have to do this. It takes 3 minutes, you get 40 times that time. And then doing their foot with a bit of body rocking. And the foot's funny because the kids are going. And then you get them going really nicely with the time. And then the clincher is this, when they go left arm, left foot. And this really fires up their right brain. And this is the one where the teacher comes back and says, "What the hell have you been doing with your kid?" And the mum's like, "What? What's wrong? What have they done? What have they done now?" And they're like, they're sitting in class and they're paying attention. And so that has to be done every day for 3 weeks. And all the science and research suggests that neuroplasticity occurs over a 3-week period. But if you do that once a week, you're not going to get the same results as someone who does that every day and for 3 weeks. Then after you've done it for 3 weeks, you don't have to do it every day continuing. But I get the parents to actually revisit it once a week to make sure they can still do it well. And then if they're doing it well, do it once a month. And if they're doing, it's a bit like riding a bike. Once you've learnt it, they're good at it. And then you can do a whole bunch of other things. This is looking at some changes, some of these kids with the flat heads, is that you can get big changes with their skull if you get them off that side of the head. And the only way to get them off the side of their head that they're squashing is that you need to make them comfortable turning in all directions and have a comfortable dural system. And so you fix those dural systems up. Now, this is going to make a massive difference to these kids' lives because it means they're not going to have a lot of those learning difficulties that they may have otherwise had and might have to work with. So you want to give them a good start. When is neuroplasticity not good for us? If you suffer chronic pain, this is a big problem. So chronic pain is signalling to the nervous system and it winds up the nerves because the nerves are getting a constant stimulus. Just like this is a constant stimulus and you get improved results. If you've got pain that's annoying your spinal cord and then annoying your higher brain for long enough, that will actually change the spinal cord and it will change the higher brain so that when the injury heals, the person still feels pain. Okay? And this also happens to people who lose a limb and they can still feel, they get phantom limb pain. And there's lots of ways to fix these people involving mirrors, and Peter and I spoke about it earlier. And you can get people to trick their brain. This indicates chronic pain. What happens with chronic pain is that the blood vessels get upset as well. So the sympathetic nerve supply to the tissues basically get constricted, and then all of a sudden they can't actually, they don't deliver the right amount of blood to those areas. This patient here couldn't stand still for more than about 5 seconds before, and he had a back problem, a disc injury, and within a few seconds, watch what happens to the coloration of his left foot. It's already starting to go red there, and his foot gets flushed with blood. And he has to move to get that blood out of there, otherwise he gets intense pain. Okay? And that's neuroplasticity occurring in his spinal cord, and so that's not so good for us when that happens, and so that has to get treated in all sorts of ways. A great article from Nature magazine showed that chronic pain results in 1.3 centimetres cubed loss of brain tissue or grey matter per year when you have chronic pain. So how else do we take advantage of neuroplasticity? don't just walk the well-trodden paths of the nervous system, of the brain. We need to exercise the parts of our brain which are not functioning as well as other areas. And what can you do to basically help your brain? Music is fantastic. Music, if you can read music, you've got very good left brain ability. If you can hear tones of music and easily sort of play by ear and just enjoy music, that's a more right brain thing. So music is a left and right brain task, and so that a lot of the wonderful musicians who are great with reading and writing music are very mathematical people as well. So that confuses some people, because like, how can you be so good at maths and so good at music? And that's because it's those notations of understanding just those notes there. Playing board games. So those board games, who's good at, people that are good at Scrabble, are they likely to be left brain people or right brain people? So again, you know, those left brain people are going to be, they're the ones who win the Scrabble championships of the world and stuff. And there really are Scrabble championships of the world. Reading is fantastic. Does both sides of your brain depending on what you're reading. If you haven't read this book and you're interested in neuroplasticity and what I'm talking about today, it's a fantastic book. Norman Deutsch, he sort of brought neuroplasticity to the general populace, and the brain that changes itself. And there's also The Woman Who Changed Her Brain, which is Barbara Arrowsmith-Young, and she's bringing her program for children with learning disabilities and inability to read and things to Australia, and most likely Sydney in the next year or two, which is really exciting. At the moment, people have to go to Vancouver to do the program first. And dancing, as I said, dancing is a great right brain activity. An interesting article I read in the Sydney Morning Herald just last month showed that basically the tango is one of the most effective ways to reduce stress, anxiety and depression. So if someone's got a lot of stress and anxiety and depression, go enrol into some tango classes and you can reduce your stress and anxiety. But those four activities, studying music, playing board games, reading and dancing, have all been associated with a lower risk of dementia. So published data, lower risk of dementia. Other things that are good for our brain, mazes. So who's going to be good at a maze, a left brain person or a right brain person? Right brain, yeah. That visuospatial, getting in and out of things and not getting lost. Jigsaw puzzles, again, good for right brain people. And learning a foreign language is great, particularly after that critical period where children pick up language early and they use the same part of the brain. But if you learn language later in life, it's a different part of the brain. So this has been identified, it was first identified in people who had strokes, and they would have a stroke, they would lose their native tongue, but they still had their learned language that they learned later in life. So they could still speak French, but they lost their English with their stroke. So pretty amazing. Lumosity, anyone heard of lumosity? Yeah. Do you play it? Do you enjoy it? Love it. It's a bit addictive, right? Lumosity is a great brain training program set up in the States. It's relatively inexpensive. They used to give a longer free period, and they used to give a lot more free games that you could just play without enrolling. But they know how everyone likes them now, so they've just sort of up the ante a bit. But it's great for people that just want all-round brain training. So they don't sort of break things down to left brain, right brain. You can certainly preference certain exercise groups for people that have a certain brain dysfunction, but it's great. Did you find improvements in yourself?
Absolutely.
Absolutely, yeah. And they did studies on uni students, kids who did it, kids who didn't do it. The students who studied lumosity at the same time as all their work got much higher university results than the ones who didn't. So it's working those pathways, and what they encourage is basically 10 minutes a day. And that's better than, 2 hours once a week. Tai Chi requires intense concentration on motor movement patterns and also stimulates the balance centres. This is Anthony Shing, very good Tai Chi fellow, and the meditative aspect has been proven very effective in lowering stress and is likely to preserve memory. So again, it's body awareness in space, knowing where you are in space, fantastic for the elderly, but also good for anyone throughout their entire life. I like to tell people that age is not a number. When they come in and say, oh, just as I'm getting old, I'm getting these problems, it's like, no, age is not a number. It's more a determinant of how nimble you are on your feet. And so if you are nimble on your feet and you can do all sorts of things, you're actually not old. But I've got patients who are in their early 50s who might as well be 90, and I've got 90-year-olds who are as good as 55. And it really is dependent on the health of their nervous system and how well they get around that determines how old they are. So, just because you've been sitting for so long, I want everyone to stand up. And if you have any serious balance disorder, probably sit down right now. But I'd like everyone just to stand on one leg. Pick a leg, any leg. Okay. Everyone focusing very hard with their eyes to make sure you stay focused. I'm going to, if you feel comfortable, I'd like you to close your eyes. Try not to knock the person over next to you. Feel that body swaying a bit more? Yeah? Okay, open your eyes. So you took away your visual input. Another good one to do is stand in a tandem gait position. So put your heel against your other toe with your feet pointing dead straight ahead like that. Okay? Now just to sort of, is that easy enough? So, yeah, feet down there like that. Just turn your head left and right for me. Anyone feel a bit more wobbly when they're turning their head left and right? Yeah? Look straight ahead. And now close your eyes. So can you feel all those ankle ligaments and muscle receptors all working hard, and you can feel it working all the way up through your hips and things? So these are great exercises to do. We all should be able to stand on one leg with our eyes closed for minimum 60 seconds. If you can't stand for 60 seconds on one leg, basically you have to keep practicing until you can. Now, some people have got diabetes and other things that contribute to being less able to do that. But if you're relatively healthy, you should be aspiring to stand on one leg with your eyes closed for 60 seconds. And then eyes closed, and then be able to turn your head left and right at the same time. And if you can do that, you're basically so much less likely to fall over, it's not funny. And so fall prevention is more important than actually picking someone up after they fall. And so if you can do that, you're not going to just fall over in the street. You're going to have to be knocked over or literally fall onto a hole to fall over. So maintain your balance, stay nimble on your feet, and that's going to really help your nervous systems. So you can take a seat again. So as I said, failure increases the likelihood of injury, changes and damage to joints during normal daily activities. It definitely increases back pain. All the studies suggest now that people with low back pain have got much less abilities, because you can actually put someone on a computer-based system, they stand on a platform, and you can measure their balance with their eyes open, their eyes closed, and people with low back pain have got less ability to stand in a central position without sort of having bigger wobbles and things. So you're training your balance system, you're using neuroplasticity to keep the cerebellum in good shape. Practice that every day for a few weeks, your balance will improve. So quite often people can't do it for more than 5 seconds, then they come in, they've been practicing every day, next thing they can do 30 seconds, before you know it they can do a minute. So our cerebellum, that lovely little brain structure at the bottom of our brain, has got the ability to compare intended movement to actual movement. Has anyone heard of Don Bradman? Hope so, if you're a good Australian. But Don Bradman used to practice, with a stick and a golf ball, hitting it against the corrugated iron and just actually, responding to that. And he was really just training his cerebellum, okay? Just like that Italian anatomist sort of suggested, is that you can extensively train someone and you'll get changes to their brain. And so with time and practice, you can get feedback changes. Now, Greg Chappell, he was one of my childhood sort of heroes that I really liked. You can get feedback mechanisms that ensure smooth and coordinated movement, so you can do complex tasks like this to make sure that it's Greg Chappell in his heyday helping with a streaker that come onto the field. So a good healthy cerebellum, and you can do things like this. So for me, it's an exciting time for brain and nervous system research, and as our understanding of neuroplasticity grows. And I guess the take-home message from me today is that we can probably all look after our brains a little bit better. It's really use it or lose it. So you have to basically keep using these structures, otherwise you'll lose the ability to do these things, and that it's never too late. So from the cradle to the grave, as far as Michael Merzenich is concerned. So thank you for having me here today to talk about neuroplasticity, and I'm happy now to field any little questions that you might have about that.